Thank you, Marina. It's my pleasure to be here with all of you today. So today we're going to talk about mental health in the workplace with a focus on accommodation. So if we go to the second page, that's really what's up on my LinkedIn page. That's who I am. I'm Lucette Wesley. I'm a workplace mental health consultant and trainer with CMHA. I have experience in the past, prior to going to CMHA, in a disability claims operation. So I was the director of a claims operation, and prior to that, a manager in another very large area that worked specifically with disability claims. So I'm quite familiar with mental health claims, with accommodation, et cetera. And I'm going to move on to the next page, tell you a little bit about CMHA. So CMHA is one of Canada's oldest national charities, and it's going to be 100 years old very soon. Our policies and programs are all about evidence, and they're informed by people's personal experience. And so people who work for CMHA and do workshops like I do usually have their own lived experience that they pull on to have these workshops. And so like other presenters, I'm the same way. I have a personal experience with a mental health issue and am fully recovered, and I really am passionate about doing this kind of work. So we work towards mental health for all, including people with addiction, and we have 120 branches throughout Canada and 14 here in BC where I'm located. So today what we're going to do is talk about mental health in the workplace context. We're going to discuss formal duty to accommodate practices and what's required in workplaces, because there are a lot of things that are happening from a legal perspective that you need to know about. We're going to consider a flexible approach to enable stay at work. That's been, I don't know how many of you have heard the term stay at work, but we talk a lot about that. Is how do you keep people in the workplace still functioning, and there are things you can do, so we'll talk about that. We're going to learn about best practices in this area related to mental illness and addictions, and then we're going to review some low-cost or free interventions and resources that facilitate a sustainable return to work for you. So, mental health in the workplace. Let's talk just a little bit about the big picture. So, mental health in the workplace has a huge impact. 30% of disability claims are due to mental health issues, but in 75% of claims, depression is a secondary diagnosis. And I have seen that trend, because I've worked in disability claims, really climb over the years. And so it is at its highest that it's ever been, at least in the last 30 years that I've been working in this industry. 44% of employees in surveys will report that they've had mental health issues. 500,000 Canadians missed work today, just today, due to a mental illness. So you can imagine the impact that has on our Canadian economy. It's a $51 billion impact. The average company loses up to 12% of its payroll to employee disability through loss of productivity and sick leave. So loss of productivity, what we often call, the term escapes me at the moment, but it'll come back in a minute. Mental disorders account for 13% of the global burden of disease. So the next page talks about numbers. So what is the impact of mental illness at work? It affects absenteeism. It affects employee assistance usage, and generally people tend to tell us that they don't always use employee assistance. We don't know why. Some people are afraid perhaps that it's not as confidential as it should be, but employee assistance should be highly utilized given the number of the mental illness that we see in the workplaces today. Disability costs are impacted. Drug costs, because of course depression medication are some of the highest drug costs that you see. Presenteeism, that's the term I was looking for a minute ago. Presenteeism is being at work but not really working. So you might be sitting there going through the motion, but your productivity is very low because you're not feeling well. And then of course legal fees that are a result of mental illness. And in some provinces, workers' compensation premiums are affected by mental disorder compensation claims. And if you're not sure, you should check that out in your particular province. So the next page talks about names for mental illnesses.
Lucette, I'm just going to jump in just for a moment and let you know that we're having a few people are finding the audio a bit low. So okay. I know that you're on the phone. If there's any way you could try speaking up just a little bit, that would be great. Thank you.
Okay, I'll try talking a bit louder, so hopefully this will work. So names for mental illnesses, there are a number of different things. So clinical depression is the most common. Clinical depression and anxiety are the things that you will see in the workplace more often than any others. And often they are concurrent, so you will see them at the same time because they tend to be very similar. Eating disorders are something that you see often in younger folks. Bipolar and manic depression disorders are also fairly common, but people with bipolar, unless they're fully under treatment and well maintained under treatment, will have trouble working. So you may not see them as often in the workplace unless they are fully in great treatment and doing well. Addictions can pop up at any time. Post-traumatic stress disorder, some industries, of course, are more prone to that. And if you've been watching recent news articles, there's a lot of talk about post-traumatic stress disorder and affecting a lot more people than we thought in the past. So there are a lot of people that are subject to these kinds of disorders by situations that happen in their lives. And then schizophrenia. Again, schizophrenia, unless in remission or under great treatment, is really difficult for people to hold down jobs. But with the right treatments, the right medications, they can. So you can go to the website listed below if you want more information on each of these diagnoses. So I'm going to talk about the continuum of mental health. And this is really important to think about. We all like to be in a point of balance. So we like to feel good when we get up in the morning. But that's not always what happens. So if we could just continue to, so this is for Kim, or Robin, pardon me, we're going to have to continue to just touch the slide to keep moving it. So if we are in a state of high energy, that's, you feel good, you wake up in the morning, you really feel like your energy is boosting. But if you continue in that vein, you could have a manic episode, and then if that continues, you could have impaired function. So on your slides, you should see that continuum all the way to impaired function. Now on the opposite side, if you wake up and have low energy in the morning, we all have those days, that happens. We wake up, we have low energy, but usually that'll last for maybe a day or two, and then we'll pop back into our normal balance in the middle. And everybody's balance point is going to be a little different. Some people are higher energy because they might be extroverts. Some are a little lower energy because they might be introverts. But we all have a balance where we like to be. So if that low energy continues and you go into a depression state, you may be able to come back into your balance, but if that lasts for too long, you may end up with an impaired function. The same thing happens if you look at the top of the circle with worry or fear. So we all have days where we may be a little worried about some things that we may not have gotten done or things that we're worried about. But if that continues, it can turn into an anxiety disorder. And if you don't deal with that anxiety early and do something about it, you may end up, again, with an impaired function. Now, at the bottom of your slide is the opposite. So you may be distracted or withdrawn. So you may not want to socialize. You may not want to be with others. And again, that can happen as long as you go back to your balance point later. But if you continue, then you may end up disassociating or having hallucinations, and that can lead to impaired function. So that's the continuum of mental health. We always want to get back to our balance point. And if we don't, that's when mental health issues develop and we end up with a mental health illness. So the next slide talks about the risk factors. So there are a number of risk factors for developing mental health issues, and genetics is one of them. If you have mental health issues in your family, you're a little more prone to end up with a mental illness. Sometimes it's your own personal history. So if you have had one incidence of a mental health issue, for example, depression, you are 50% more likely to have a second one. unless you've learned your triggers, unless you've learned how to deal with them, recognize them, and address them immediately. Trauma is another risk factor, and we talked about earlier how depression can be a secondary to physical illness. Often with disability claims, you'll have an illness or an injury, but depression will be the secondary. Personal stressors, if you are under a lot of stress, whether it's positive stress or negative stress, if it gets to be too much, then you are at risk for developing a mental health issue, or workplace stressors. So all of these are risk factors. Now we'll go to the next. It's more common than we think. I want you to think about yourself and the people you know. So the people in your environment, the people you work with, your family, the people that you socialize with, how many of them do you know who are struggling with a mental health illness or issue? When I do workshops in person, I ask people to stand up and to sit down only if they don't know anyone who has a mental health issue right now. And what I find is that almost nobody ever sits down. All of us usually know someone who is struggling with a mental health issue. And the statistics tell us that it's 1 in 5 will have a mental illness in our lifetime. Most of the 1 in 5 will have a significant episode between the ages of 18 and 65. So what happens between 18 and 65? We're at work. So that's why we talk about how important it is to deal with mental health in the workplace, is because that's the period when most people develop mental health issues. And many will not seek or get help. So if you think about that, why wouldn't people seek or get help? Well, there's many reasons. Sometimes it's because they don't even know that there's something wrong. This is just how they feel, and they don't realize that they need some help. Sometimes it's because they're afraid of the stigma, and stigma is still something that we hear about all the time. We're trying to reduce that in the workplaces. CMHA has a goal of trying to get workplaces to start talking about mental health so that we can reduce the stigma. Sometimes they just feel like it's going to make them feel or look weak if they admit they have a mental health issue. This is the one that bothers me the most, because if people have a mental health issue, it doesn't mean it's a lifetime sentence. If they get help, they can get better. That's what happened with me. Once I finally decided that I did need some help and I couldn't do it on my own, I got better. And I've never looked back. So it's something to really think about. The next slide talks about you thinking about this yourself. If you were struggling at work, how would you want your manager to treat you? If you were at work, how would you want your manager to communicate with you? If you were off work, pardon me. So if you were sick, if you had a depression, anxiety, something, and you were off work, how would you want your manager to communicate with you? If you were returning to work after sick leave, what would you find helpful from your manager? I want you to think about those, because we're going to talk about those a little bit later. So the next slide talks about how important it is to have early awareness and effective treatment. So the earlier you can impact on what's a developing mental health issue, the better it is. What happens with identifying it early and getting treatment, and that also means in the workplace supporting employees, the amount of time on disability can get greatly reduced. The amount of time for treatment is less if you catch it early, if you know the signs and you can start dealing with it early. The severity of symptoms are usually reduced, and the duration of illness is reduced. And it improves greatly the probability of return to high levels of productivity. So the next is working in a healthy workplace also is very important. Now, working in an unhealthy workplace, which contributes to the stressors may not be good for someone who's got mental illness, but in a healthy workplace, it can significantly contribute to recovery. It's very important to have routine in our lives because it gives us a reason to get up in the morning, and we have a pattern that we follow. There's a lot of social contact that happens at work, and that's something that people need in their lives. Even introverts need that social contact. Activity, work gives us something to do each day, and it protects our mental health. A feeling of contributing to something, having a meaning to our life, a purpose, our work may be something that meets our needs for that. These are our protective factors for mental health. And then that sense of identity. Who are you? How do you define yourself? Do you define yourself by your job? That's dangerous because you don't want your job to be everything in your life, but a lot of people will ask, so what do you do for a living, or what do you do? It makes it difficult to define yourself in terms that are socially acceptable if you don't have that identity to talk about. And then financial security, of course, is so important for all of us. And when you are disabled, when you have a mental illness, unless you have a great benefit plan and you have a short-term disability and long-term disability, it can be very financially taxing. So let's talk about what your duties are in the workplace. So duties and regulations. The human rights codes, whether it's provincial, territorial, or federal, all of them have a Charter of Rights and Freedoms with similar obligations. They may be written a little differently, but they all really mean the same thing. Everyone has the right to equal treatment in employment and cannot be discriminated against on the basis of actual or perceived disability. But equal treatment does not mean the same treatment. So you should take a look at your own provincial, if you're a provincial organization. If you're federal, you can look at the federal human rights, but read up what the rights actually say. They sometimes specifically will define mental illness and drug and alcohol dependence as disabilities, but whether it's defined or not, in most situations, arbitrations, legal decisions, they are both considered to be a disability. And all parties have a role to play in the issue of human rights and what happens. That's the employer, the employee, and if you're in the union shop, the union has a part to play as well. So if we go to the next screen, this is what the Canadian Human Rights Commission says. As an employer or service provider, you have an obligation to take steps to eliminate different and negative treatment of individuals or groups of individuals based on prohibited grounds of discrimination. This is called your duty to accommodate, and it applies both to your employees and the public you serve. And so this is that duty to accommodate on the grounds that are in the discrimination definition, and certainly disability is part of those grounds. So you have a duty to accommodate only when a person's needs are based on those grounds of discrimination, the Canadian Human Rights Act. And that's where definitely disability is listed as, disability is listed as a ground of discrimination. So if you look at the bottom of the screen, I have the actual website where you can get that particular information on the Canadian Human Rights. Now, on the next screen, we talk about undue hardship. So the duty to accommodate does have some limits. Sometimes accommodation is not possible because it would cause an organization to have undue hardship. Now, under the Canadian Human Rights Act, an employer or service provider can claim undue hardship when adjustments to a policy, practice, bylaw, or building would cost too much or create risks to health or safety. There is no precise legal definition of undue hardship or a standard formula for determining undue hardship. Each situation should be viewed and assessed as unique and assessed individually. And again, there, the website, I think, has some information. But it's usually legal precedents that will determine what is undue hardship. And it will apply differently to different employers, depending on, one, the size of your employer. So if you are a very large organization, you would have a lot of difficulty proving that accommodating someone would be to the point of undue hardship. But if you're a very small employer, something that might have 1 or 2 employees, and one of those employees might need an accommodation, it may be very difficult to accommodate depending on what the needs are. So in that case, you may be able to show that it's undue hardship. But it's something that, should you be concerned about trying to accommodate someone and you're not sure whether you would meet the test of undue hardship, you may want to talk to a lawyer about that, because this is one that is very important to understand and to be clear about, because you do have a duty to accommodate. Now, there's one other duty. On the next page, we talk about legal cases. So the duty to accommodate, courts across the country are adding the obligations to accommodate mental illness in the workplace. So not only is it human rights, now the legal cases, for example, if someone's employment is terminated and the individual comes back and sues on the basis of having a mental illness, it's coming up in those legal cases as well. But there's one more that's coming up in legal cases, and that's the duty to inquire. This is something that when I talk to people in workshops, they often don't know about this one. So I want to spend a little time on that. What happens in legal decisions, different judges have written decisions with different wording. But what's coming out quite frequently is that if the employer ought to have known, so when the employer is aware or reasonably ought to be aware that a disability is negatively affecting an employee's work performance, the employer has a duty to inquire about the situation and accommodate the disability to the point of undue hardship. So this is a legal opinion that was written by Murray Murphy, which you can look up. It's called The Duty to Inquire, the Problem with Turning a Blind Eye. So it's very important for everyone within a workplace to understand, who's in a leadership role, to understand the duty to inquire. So if there are signs that there might be an issue, a mental health issue, then you need to inquire, you need to ask, and we'll talk a little bit about how you do that, how you have that conversation. But you need to ask whether there is a disability or a mental health issue that's affecting the work before you start taking disciplinary action. And even if you are going down the road of disciplinary action, and then you subsequently find out that there is a mental health issue, you definitely need to change your tact and talk about accommodation. Now, an employer cannot mandate a treatment plan. So what that means, what's come out in legal cases, an employer can't tell the employee what they need to do to get better, what kind of treatment they need to have. They can ask if they are under appropriate treatment, but they can't mandate what it is that the employee needs in order to get better. But the employee does also have a duty within an accommodation process to actually participate in that accommodation. So an employee seeking an accommodation must provide enough information so that the employer can understand the accommodation needed. So the employer really needs to know how the employee's condition affects their work. They don't have to give the diagnosis or a history of the illness or the treatment, but the employee does have a responsibility, once an accommodation's been done, to meet the essential job requirements and standards of their position or modified position. They need to continue to work with their manager or supervisor to make sure that the accommodation remains effective. But the disabled employee cannot expect a perfect solution. This is what's come out in legal cases. If a proposal that would be reasonable in all the circumstances is turned down, the employer's duty to accommodate has been discharged. So that means if you offer an accommodation and it meets the needs of that employee, not perfectly, but does accommodate for the issues. And I'll give you an example. So if someone were to say, you know, I need an accommodation. I need to be in the corner office with all the windows over there. Well, that corner office may very well be the manager's office or maybe the CEO's office. Well, that's not what they really need. What they may need is more light. What they may need is a quieter place. Or what they may need is less distraction or less disturbances during the day. So maybe somewhere a little more private or a little more quiet. So you may be able to do that by, you know, giving them a light that has full spectrum with more light on their desk. You may be able to put a wall panel up to give them a little less distraction or less, or giving them a quieter spot. So it doesn't have to be the perfect accommodation, but it has to meet what their requirements are or what the issues are. So if we go to the next page, workers' compensation is the other thing to consider, and most provinces or territorial workers' compensation systems have some mental illness wording in the workplace, and some of them are strictly around bullying and harassment. But it's important for you to have a look at your own and see what's in there. As we move forward, I think in time and mental illness becomes more talked about, there may be even more changes to workers' compensation cases. So let's get to the nitty-gritty. What's an approach to enable stay at work? So how do you approach that person who's struggling? So where do you start? Well, you step back from any assumptions, any judging or labeling. It's really important that you be neutral when you start thinking about having a conversation. Identify changes you've noticed. So you need to be clear what it is that makes you think there might be an issue. So what have you noticed? And be very careful that you've noticed it. Because if Mary comes to you and says, I noticed that Joe has been acting funny, he looks like he's not sleeping, he's disheveled, he's a little more angry these days. Well, if you go to talk to that individual and you say, well, I've heard that, or Mary told me that, and you start naming what's going on, they're going to deny it. Or they may say, it's none of her business, why should she talk to you about that, et cetera, et cetera, et cetera. What you want to do is, if someone tells you there's some issues and you haven't seen it, you want to go notice on purpose. So you want to actually go see what those changes are, because you want to be able to talk about it from a personal perspective. Now the next item, consider the context. Excuse me, has this person recently had something in their personal life that might have really contributed to them having an issue? Did they lose a family member? Has their dog just died? Is this maybe just a short-term thing because they've lost a pet? Has there been a divorce in their family? Do they have a child who's perhaps getting into drugs? Is there something going on that you know about that may be contributing to that? That may help you in the discussion you have. But if you don't know anything, then you don't know anything. So you need to ask the questions to find out if there's anything going on. And then prepare for the conversation. Don't just go into it blindly. Make sure you're ready for it, and we'll talk about those steps. So the next one is how to have that conversation. So step 1 to 5, you're going to talk to yourself. You're going to talk about what you've noticed. You're going to say, I'm wondering, and then how can I help, and take a moment. So let's look at each of those individually. So if we go to the next slide, we'll just talk about talk to yourself. So before you start, are you in the right frame of mind to start the discussion? Are you aware of what might trigger you? Is there something that they might say that's going to make you go ballistic? If someone talks about perhaps drinking, is that something that's going to create an issue for you? So you need to be very non-judgmental when you have this discussion. You need to be open. You need to hear what they have to say. But if you're going to be triggered by something, and you yourself may be someone who easily gets emotional when you know someone's hurting, make sure you have some Kleenexes. Make sure you are prepared for that conversation. And there's nothing wrong with being emotional because it shows that you care. Have you envisioned what success will look like? Do you know what you want out of this discussion? Do you have some time blocked off? Do you have a safe place? You don't want to do this rushed because it may take a while for this person to open up. And you want to be somewhere not behind your desk where you're in a power position. It may feel intimidating to the individual. And if every time you bring someone in your office, it's because you want to talk about a problem, then that may not be the right place to do it. You may want to find a table where you can sit beside each other. Are you able to defer some of your needs? You need to be careful that you're listening, not trying to talk. You don't want to express yourself. You don't want to solve the problem initially. You want to listen. You need to be fair, non-judgmental. And then think about the context, if you're aware of any, and then label your assumptions. If you have been assuming this person is, they're just trying to get out of work or whatever, make sure you think about those because you want to be non-judgmental when you sit and have this discussion. So next we'll go to I notice. So now you're ready to have the discussion. You're prepared. You've got to speak to what you see. Mental illness is not invisible. Usually there's something you will have seen. It might be their physical appearance that's changed. They could be looking more disheveled. They could be looking tired. Sometimes it's the opposite, and they look dressed in more flashy clothes than they used to. They may look like they're losing weight. Their eating habits may have changed. Anything else in their personal appearance? Sociability, they may not be as social as they used to be. They may be withdrawing. There may be errors in the work and the quality of the work, or there may be more accidents happening. They may not be as punctual as they used to be. There may be something happening, and they're coming in late, or they're leaving early, or they're taking longer lunches. How they respond to new tasks or things that they should know, they should be familiar with, if that response is changing, what does that mean? If they're working longer hours, if there's no real reason for them to work longer, the work hasn't changed, but they're working longer hours, that might be a sign of something. Maybe they can't get anything done during the day because they're not functioning well. Are they unable to take a break? Sometimes people who never take breaks, it's because they just can't get things done because they're not feeling well and they're not able to be productive. So go to, and as I mentioned, make sure you have noticed these things. And with mental health, what you're talking about is you're seeing changes. If someone's always been the same, then likely it's not a mental health issue. It perhaps is just the way they are. It's their personality. But if you're noticing a change, then there may be something going on. So the next one is I'm wondering. So then after you've said what you've noticed. So Mary, I've been noticing that in the last, well, what you want to start with is, Mary, you're always a really productive part of our team, and you're always very open in meetings, etc. But I've been noticing lately that you're not quite as open. I've seen you sit through our meetings and not say a word, whereas before you would have really been open, and I've always appreciated that about you. So I'm wondering if there's something that may be going on, something that I might be able to help you with. Can we talk? So I'm wondering, step back from your assumptions, be curious, listen objectively and non-judgmentally, and that's so important. And listen to really understand what they're saying. So you may need to really probe and really continue asking questions to understand. And ask only one question at a time, and then wait. Listen for the answers. Allow pauses. What happens often is we just jump in. We want to, we don't like silence. We just want to go with another question. But wait. Listen for the answer. If they're going through a depression or they have an anxiety, they probably need a little more time to think through things. Avoid interrupting them. Just listen. Seek clarification. So if Mary says, "Oh, I'm just tired," well, you might want to say, "Well, are you having trouble sleeping at night? Is it something that could be helped if we were to look at your hours a little bit?" You may want to go into some details, but not too many at the beginning. You're just trying to clarify. So is it that you don't sleep at all? Is it, are you, has something changed in your life that's making it difficult for you to sleep? But don't problem solve at the beginning. Take more time to gather information than you normally would. You really want to listen. And it may take more than one appointment, because the first time you talk to someone, unless you have a really good open relationship and a real trust, they may not want to open up to you. So they may say, "Oh, no, it's okay. I'll work on it. Don't worry. I'll be better." If that happens and they don't want to talk about anything, you may say, "Well, I'm glad to hear there's nothing going on. I'm going to meet with you again next week, and we can talk and just see whether or not things have gotten better. So let's make an appointment for Wednesday next week at 1 o'clock, and I'll meet with you then and just see how things are going and progressing." And set that time in your calendar. Make that appointment very specific. Now they're going to know that, yes, you're going to follow up, but they also know that, yes, you do care, because you're going to want to make sure that they're doing all right. So make sure that you are prepared to spend more time if you need to. Be aware if you're arguing or defending in that discussion. So if they say something that makes you feel, like your back gets up, your shoulders, because it's something that you think is untrue, or it may be accusing you of something, well, don't argue or defend. Just let them talk. Just keep asking questions. Say, "Tell me more," until you're really clear what might be going on. Now, if you've been able to do that in that discussion, and you've gotten all the information you need, then you want to move into, well, how can I help? What can I do to support your success at work? That might be a term you use. Or, how can I help you be successful at work? And then consider what you might want to do that's a small accommodation. There's lots of very small everyday changes and supports that you might be able to put in that would help that individual. And it may be just a short-term thing that you can resolve very quickly. But you want to make sure the employee is going to contribute to their success as well. So you might want to talk about, well, what do you think you would need to be able to get more sleep? A change in your hours, is there something that might help you? Well, if we change your hours, what would you be doing then to still get your work done? Is there something we can do around that? If appropriate, you may want to write down the steps, either with the employee, so document what you're talking about, or after the meeting. You may want to document it and send it back to them for them to see. And there is a website, which will be at the bottom of this page, that will have a written work plan that you can go view and use. But it's a very in-depth, very complicated one, and it may not need to be that complicated unless someone has huge issues and the work is really struggling. Then you may want to use that whole sample work plan. And then after you've done this, take a moment to thank yourself for having gone through that conversation, because these conversations are not easy, and sometimes you may be feeling a lot of stress after that conversation, particularly if someone was very emotional, or if someone was very concerned, or you found out some information that really worries you, or that you didn't expect at all. Someone could, in that discussion, tell you about the death of a child, or it may be something a lot less troubling than that. But if something was troubling in that discussion, take a moment for yourself. You may be stressed. Go for a walk. Have a drink of coffee. Go do something that helps. But maintain the confidentiality that person shared with you, very personal information. Because what happens in a lot of workplaces and this is a real concern, is that people gossip. People share information that they really shouldn't, and that's very destructive in these kinds of situations. So take a moment to do something for yourself, to thank yourself for having done it, and to make yourself feel better. And I just noticed that I did not put that website at that spot in the page, but it is at the back. When you get to the resources, when we get there, I'll point out to you there's a work plan there where you can actually use it to write down what kinds of interventions might be necessary. So we're going to do a quick case study just to talk about how you would deal with this. So we're going to walk through an example. So this is Mary. Mary has been one of the most social members in a workplace, in your workplace, often seen as the life of the party. However, very gradually over the past month, she's begun to withdraw. She no longer makes eye contact when she says hello. Her smiles are rare. She has moments when she seems like her previous self, but your intuition tells you something has changed. So what you'd want to do in your conversation, first of all, is talk to yourself, be sure you're ready, and then you'd want to talk about what you've noticed, listen, and then try and work together with her for a solution. So it might go like this. Mary, can I see you? Can we go for a walk outside, or can we go for coffee? I'd like to have a chat with you. Mary, you've always been such a lively part of our meetings, and you're always really contributing to everything. But I noticed lately that, you're not as active in our meetings. You're not making eye contact when you say hello in the morning, and you're just not smiling as much as you used to be. I'm wondering if there's anything going on that I might be able to help you with. And then you listen, and just wait to see what Mary has to say. And if Mary just says, oh, it's just a bad time, I'll be better, that's when you say, well, Mary, I'm really concerned about you. I want to help you if I can. So why don't we meet again next Wednesday, or maybe 2 weeks, depending on how serious you think it is. Let's meet on that day. Let's set an appointment for both of us to put it in our calendar, because I'd like to check back with you at that time and see how you're doing. Now, if she is open to talk to you, then you might want to say, well, Mary, so let's talk about, what's going on. Maybe there's something we can work on together to help you be better in the workplace. Maybe some things, we could change a few things just temporarily to see how it would work. And then go through different things that perhaps would help her. Now, if it seems like it's something much more serious, you may want to think about doing a more formal accommodation. But in this case, it sounds like maybe a few little things might be enough to keep Mary still at work and being more productive. So let's talk about what are best practices in accommodation. So let's do the basics. So early intervention is key. Get there early as soon as you notice things. Trust has to exist. That's really important. The culture of your organization is important. If nobody ever opens up or talks about mental health and it's a real taboo, it's going to be difficult for someone to talk about it. There is no one-size-fits-all. Every person is unique. Every person is different, and so what they may need may be different. So you need to be prepared with a lot of openness about what might need to happen. So flexibility is often the biggest thing. To be a little more flexible, maybe with time, maybe with some of the duties, but flexibility is often all that's required. But the employee does need to be involved at every step. And I'm going to give you a controversial comment. Most situations don't require a medical report. I know in the past, whenever we talk about accommodation, people will say, well, we need something from the doctor. If something's really serious, if there was a really serious issue, you may want to get a medical report. But if you want to build trust, if you just want to be a workplace that really is supportive of employees, you may just want to say, let's just chat, let's find what we can do temporarily to make it better. If it goes on too long, then you may need a medical report. Because what happens is, unless that person is already seeing a psychiatrist or seeing a psychologist, if they're just talking to their GP, the GP may not have a whole lot of information to share with you. The employee probably knows best what's actually going on. Now, the next page continues with basics. Ask the employee what they need. Limit to 1 to 3 short-term goals if you're actually going to put some things in place. Don't do too much too quickly. Make it 1 to 3 short-term things that you change. But make sure you have a goal. Make sure you are clear on what's expected. Because if you just say, well, let's just change this, they don't really know what's an appropriate performance. So you need to be clear. And then provide constant feedback and positive reinforcement. Increase the goals as they go. So if you're just making it a small change, you may not need to change it again. But if you're making a change that's going to remove some duties, for example, you want to add duties back in. And then encourage open communication, but plan how to respond if there's a relapse. So you'll want to ask them, so if I start to see, you know, this changing again and you having some problems, how do you want me to address this? And then consider the coworkers, because if you're changing something, what are you going to tell the coworkers? What are you going to talk to others about? So you may want to say, Mary, you know, I'm going to have to tell your coworkers that we're accommodating and changing your work a little bit. How would you like me to address this with them? What would you like me to tell them? And then follow her lead. You know, don't break confidentiality, but if she's open and is open to answer questions from people, then that may be how you want to express it. Mary's not feeling well right now, so we're changing her work a little bit, and Mary's open for you to come talk to her about what's going on, so go ahead. Or it may just be, Mary's not feeling well, we're going to be accommodating, just like we would for any of you if something was going on, so we're going to make a few changes, but Mary really doesn't want to talk about it, so please, you know, respect that. Maybe as simple as that. So general strategies to consider, and I see the time is getting short, so I'm going to go through these fairly quickly. These strategies are in the work, if you look on the bottom, the website address, workplacestrategiesformentalhealth.com. That is a fabulous website that has all sorts of strategies to consider. These are general ones that you may want to think about. It might be the communication and supervision that you want to think about. Might be the training approach, might be environmental needs, it might be flexibility. But the next page shows you how detailed that website gets. So in that website, it'll talk about if it's a problem with concentration or attention to detail, here are 7 things you might want to think about, you might want to consider. It doesn't mean you do them all, but it means these are the things you can have in your back pocket on things you might be able to do when you have that discussion with the person and you're starting to plan an accommodation. And there's many, many different types of symptoms and what to do for those symptoms. Now there's another case study here which we're not going to go through, but I want you to think about this one. So it's an employee who's been off work now for 4 months. He's returning to the workplace. Prior to going off, they were having performance problems and workplace conflicts with coworkers. The treating physician has advised that they're fit to return to work, but they need reduced stress. Now, from your perspective as a manager, they were a strong performer for several years. So this was a good employee. But just recently, there were increased absences and decreased work quality, so something going on. You had concerns about their performance, especially the behavioral issues, arguing, dominating meetings, negativity, constant criticism of coworkers, and there was a loud and public conflict before they left. Since then, the employees have been gossiping about their coworker. So my first question is, what did you do about that gossiping? Did you just continue gossiping? That's very important. You need to remove that in a workplace. Now, however, the employees were concerned, so you have to think about the employees when you're going to address this one. From the employee's perspective, he's been off for 4 months. He's being treated for major depression and anxiety. So the person's better, but they're very nervous how the coworkers will react. And they have a gradual return to work, but they need reduced stress. What does that mean? You don't know, not till you ask the questions. And they are concerned that their anxiety is triggered by criticism. So how are you going to give feedback if that is the issue? you're going to need that individual to give you that information in the discussion that you have. Sleep is hit and miss. Well, is there anything you can do about that? Short-term memory is not what it was. Concentration is compromised. So what are you going to do to help them if they tell you that short-term memory is a bit of a problem, concentration? So that's to do about the employees. So you need to make sure that the rest of your employees feel safe. So you may want to say to that individual, go through the whole discussion, about being such a good worker in the past. There were some changes. Here's what we had noticed, and we're really wanting to help you get back into the workplace and make sure that you can be successful. And then when you go through some things and you identify changes you can make, at the end you may want to say, an outburst with employee X. I think it's very important that you and that employee meet ahead of time. So maybe we could have a coffee break meeting before you come back to work, and we could have you and employee X meet together, and maybe you can talk about with that employee what happened, and perhaps try and resolve that issue before you come back to the workplace. How does that sound? If you need my help, I can be there with you. So that's the way you might address that one. So here's some resources that you want to think about. Of course, for someone who is having a mental illness, you always want to talk about, are you getting treated? Are you under the right under treatment for this? I just want to make sure that you're getting everything you need. And the family doctor is always the first point. You could refer them to a crisis line if that's required. You can refer them to the Canadian Mental Health Association, their employee assistance plan, and don't forget that you may have psychological benefits under your plan. And the other resources are online resources. So we talked about the ones at the bottom, workplace strategies for mental health. Mental Health Works in the middle is another one where you may want to go to look at accommodations. Living Life to the Full is a program to help people. It's one that they have to pay for, but it's very inexpensive, and it allows them to start changing the way they think and process things to get feeling better. Here to Help is a website with lots of resources, and of course CMHA. And CMHA does a lot of other training for workplaces on mental health awareness, leadership training on exactly these kinds of discussions, suicide awareness, peer support, and psychological health and safety in the workplace. And in BC here, we're holding a bottom line conference in February, and I invite anyone who's in this area who may be thinking that their workplace culture is a problem to attend this conference. It will have workshops during the conference, and it's all about transforming workplace culture. And I thank you all for listening to me. I sped up a little bit at the end there, but my name is Lucette Wesley. That's my email address. And if you need anything further, you can contact the Canadian Mental Health Association at that phone number below. Thank you. Any questions now?
Wonderful.
5 minutes.
Thank you, Lucette. We do have some questions, so we will just dive right in, okay? So we have some questions about duty to inquire. Now, what do you suggest if you were inquiring with an employee that you suspect might be having some issues, but after your talk with them, the employee doesn't acknowledge or disclose anything?
Well, what you have to do is be very careful that you document that you had that discussion, because you want to be sure that should anything come up later, it's clear that you did ask. Now, you want to consider a couple things. One, did that person feel like they could trust you? Did that person think that the relationship with you is good enough to open up? Do you have issues in your workplace about confidentiality, et cetera, et cetera? Sometimes it may be that you want a second person to have another discussion with them if things don't improve. But as I said before, ideally you want to say, well, I am concerned. Why don't we meet again in another week, and we'll see how things go. And the second time you meet with them, you talk about what you've seen the second week. Has anything changed? If things are still the same, you want to talk about it again. And generally, if you are doing it with genuine care and that the person really does trust you, they will probably open up at some point with some detail. But if they don't, then you have discharged your duty to inquire, but you need to at least try and document very well what your discussion was. And if you're in a union environment, you may want to ask a union person to actually chat with them, tell them that you're concerned and you think you may need to help them and support them to be productive in the workplace, and the union shop steward may be able to do that.
Great. And along the same lines, how do you approach weighing the balance between personal privacy with also the employer's duty to inquire?
Well, when you're inquiring and you're talking to someone about issues, you have to always respect that you do not need to know the medical condition. You should not be asking about a diagnosis because it really doesn't matter what the diagnosis is. The issue is, what are they struggling with in the workplace that's making them not able to do their work? And is there something you can do to help them for that? So you can't continue probing about personal life. You can't probe about what's going on. All you can do is relate it back to the workplace, the impact on their work. And if you stay with that, you should be able to navigate through that.
Okay, great. And when you're having those HR meetings, is it usual or acceptable for an employee to ask someone else to attend with them?
Well, I think that's entirely up to you. And I'm going to suggest these should not be HR meetings. This should be the meeting of the direct supervisor, because the direct supervisor is the one who has the relationship with the individual. They're the one who actually knows what the issues are, and they're the ones who probably know what changes they might be able to make. So that's number one. Then number two is, if someone is really struggling and they think they need to bring someone in, you may not have a choice if you really want to resolve things. If it's an HR, then you may have some whole rules around that. I would suggest that if they need to bring somebody with them, there isn't a trust there, and that's a problem. So if there isn't a trust with you, maybe there's a trust with someone else. Or if it's because they will get too emotional or they're too worried about it, then maybe they need someone else. But I would be concerned that it might signify either the workplace may be a problem, your relationship may be a problem, or confidentiality may be an issue, or the trust isn't there. So you really want to examine yourself and explore what might be the reasons behind that. If it's somebody very young, I have seen a very young person who just didn't know how to navigate it, who brought their parent in. And it was awkward, but it can happen.
Okay, and what happens if an employee happens to bring up this issue of a mental illness right in the middle of maybe a performance review? So perhaps they're actually, or maybe it's a meeting about poor performance. Do you handle that any differently?
Well, as soon as you hear that there might be a mental health issue, you need to change your tack. So if you're going down a performance discussion route because someone's not meeting the work expectations, then I think you need to stop what you're doing, because you're now going to need to retract and go back to, well, let's talk about that. I'm concerned about your work, but I really want to support you to be productive at work and to meet our expectations. So let's talk about that. What kinds of things might you need to be successful? Because now you know there's something going on. So from a human rights perspective, you cannot continue down the performance management route. And you may want to end the meeting right then and say, well, you know what, let's get together again. Let's just leave this for now. Let's get together next week and let's talk about that, because I'm really concerned if you have some issues going on, and let's see if we can find a way to support you to be productive in the workplace. But don't forget, they have to contribute to it too.
Okay, and I think we'll just end with one last question. While you're in the process of having these conversations, and I know that you discussed, how to take some time for yourself after having these conversations. What happens if, in the midst of the discussion, somebody does suggest or talk about possibly doing harm either to themselves or to someone else?
Well, I highly recommend that always in a workplace you have someone, whether that's you or someone in a health and wellness committee or some committee within your department, have some training on suicide awareness, because it's very important that you be prepared should something like that come up. And there's very specialized training. CMHA does do training on that. It's one of the things that we offer. The Mental Health Commission of Canada offers some, but there are 3-hour training that CMHA does that just gives you the basics to be able to handle that discussion in a way that keeps that person safe right then and there. But if you want to be really educated on that, then there's a 3-day program through the Mental Health Commission of Canada called Mental Health First Aid that perhaps someone in your health and safety department could take. But there is a 3-hour one through CMHA, which is just for supervisors, leaders, and it's excellent. I've taken both of them, and they're very, very good. And they help you feel confident in how to actually ask the questions to really understand what might be going on.
Good. Well, thank you, Lucette, and I second your recommendation. This is the second time we've had someone from the CMHA BC presenting for us, and always full of information. Highly recommend that you check out some of the resources that Lucette discussed today. So I'd like to thank you again, Lucette, for being with us today. It was a wonderful presentation. Before we sign off, I do want to remind everyone that we are going to follow up with you by email tomorrow morning with the webinar recording and the presentation slides. If you don't receive that tomorrow, sometimes they can get caught in spam filters, so do just pop us an email at webinars@charityvillage.com and we can make sure that you get that. We'll also include a link to a short survey, so if you can take a moment to fill that out, it's really helpful for us in further refining our webinar content and our delivery. And you'll have an opportunity there to let us know if there's other topics you'd like to see covered in a future session. So with that, I'd like to thank you all for joining us today, and I hope you all have a wonderful rest of your day. Thank you so much.
Thank you.